जा तरह जा। We have already completed formation of the heart tube. I think you have learnt it by heart, because it is very important, the development of heart tube, because from that heart tube all the components of heart will develop. Today's portion is sinus venosus. You know sinus venosus is the caudal end or venous end of the heart tube. I have partly drawn it. This is the caudal end. Here lies at this portion lies the septum transversum. That I have not drawn. Here lies the septum transversum. This vessel actually is passing through the septum transversum. So you should imagine that there is a septum transversum at this end. Now, here you see the sinus venosus has got two horns, right and left, and to this horn, three important veins actually draining. Number one, this is the common cardinal vein, this is the umbilical vein, and this is the vital vein. And you know these veins are coming from which source? Umbilical vein, that is coming from the placenta and chorion, umbilical vein. Vital vein is coming from wall of the yolk sac, and cardinal vein. Cardinal vein is coming from the body wall. It has got two parts, anterior and posterior. Anterior part from anterior body wall and posterior part from posterior body wall. I have only drawn that part, that is a common cardinal vein. It is like that. It is anterior part and posterior part, and this is the common part. So I have drawn the only common part of the cardinal vein. It is draining the body wall. Now, what happens to this sinus venosus? Here you see the sinus venosus outwardly. It is separated from the primitive atrium by this groove. Here there is two groove. Right? Now, this left groove encroaches internally. This groove actually encroaches internally. Before that, you should know that this opening is a wide opening between the sinus venosus and primitive atrium, wide opening, wide, transversely oriented, central in position. Actually, you know, when the heart is bending, first is formed at a C or U-shaped loop, then it forms S-shaped loop, right? When it is become S-shaped loop, then what happens? The sinus venosus is coming on the dorsolateral aspect of the primitive atrium. It is this is the cranial portion, is the caudal. That means here lies the conus bulbar cordis, and this is the ventricle. The ventricle lies at the apex of this loop, and this end lies the atrium and sinus venosus. Now this portion, when it is excessively grow, then it becomes like this. It becomes S-shaped. That means this sinus venosus comes to the dorsal aspect of the atrial cavity. It comes to the dorsal aspect of the atrial cavity, and not actually exactly dorsal, but dorsolateral, to some extent lateral. So if I draw a picture here, suppose this is the common atrial chamber, and it is the dorsal aspect. It is the dorsal aspect. So this opening, first opening will be like this. This opening. Now you imagine that it is dorsal in position, and it is this opening. Through this opening, it is communicating with this primitive atrial cavity. This cavity, to start with, remains oval, wide, and central in position. এবার তো ক্লিয়ার তো ওপেনিংটা? আমি তো ডরসাম থাকতে পারবো না এই বোর্ডে, তো 2 ডাইমেনশনাল, 3 ডাইমেনশনাল তো না। তো এইখানে চিন্তা কর, এখানে আর একটা ক্যাভিটি আছে, সেই ক্যাভিটির ওপেনিং এটা। আমি সেই ক্যাভিটিকে কেটে বাদ দিয়েছি, তো শুধু দেখছি ওপেনিংটা, রাইট? নাও হিয়ার ইউ সি this group, left group, which is separating the primitive atrium and sinus venosus, it becomes deepened, it grows inwards. It grows inwards. It indents, or it grows inwards so much so that this opening ultimately will be transformed into a vertical slit. It will transform into a vertical slit. This opening will look like this. First it was big opening, central in position, wide. Now because of this development, this opening has become like this. তাহলে this opening is just এটা আমরা বলবো সাইনোঅ্যাট্রিয়াল ওপেনিং, সাইনোঅ্যাট্রিয়াল ওপেনিং, right? Because of this, here you see left part of the sinus venosus has become practically functionless. Almost entire blood which is coming through these veins, they come to the right portion of the sinus venosus, and then it goes to the primitive atrium. বুঝতে পারলি? Now let us discuss about the fate. What will be the fate of all these things? Now, after this, it becomes so much reduced that the right horn looks like it seems to be the tributary of the left horn seems to be the tributary of the right horn. It becomes so much reduced that it seems to be the tributary of the right horn. Right? Now let us discuss one by one the fate of these components. Here, the left part of the body of the sinus venosus and left horn. This is the left horn and this is the left part. This is the left part and left horn of the sinus venosus will form coronary sinus. Left horn along with the left part of the sinus venosus will form coronary sinus. Coronary sinus. Coronary sinus. What is coronary sinus? Coronary sinus is the venous channel of the heart. Coronary artery and coronary sinus. Through coronary sinus, venous blood passes. Now, the left umbilical vein, that part, left umbilical vein, when you will study the liver, you will find ligamentum teres hepatis. You will find one important component, that is ligamentum teres hepatis. At the time of studying the liver, that ligamentum teres hepatis actually, it is the degenerated part of the left umbilical vein. But here I have already told you, at this portion lies the septum transversum. And all these structures actually coming here after passing through septum transversum. So within the septum transversum, liver develops. So it is actually passing, so the developing liver actually separating these things into suprahepatic part and subhepatic part. This is the suprahepatic part and this is the subhepatic part. Subhepatic part persists as left umbilical vein in the intrauterine life. After birth, that has become degenerated from the teres hepatis. But suprahepatic part of the umbilical vein is degenerated, disappear. So that part gone. Likewise, vitelline vein also gone. Vitelline vein and suprahepatic part of vitelline vein. So only lying the left horn as well as common cardinal vein. Right? This common cardinal vein, will form oblique vein of left atrium. The common cardinal vein will form the oblique vein of left atrium. This is the common cardinal vein, oblique vein of left atrium. Now again I am repeating, the left horn and left side of the body of the sinus venosus, what will be the fate? Left part of the body along with left horn will form the coronary sinus, and left common cardinal vein will form the vein of the oblique vein of left atrium, and rest will disappear. That is the suprahepatic part of the umbilical vein, vitelline vein, etc. Right? Now come to the right side. Right side is well developed because all blood is coming through the right side. Now this right umbilical vein disappears. Right side, the right umbilical vein disappears. But through all the extent of the right umbilical vein disappears. But on the left side, only the suprahepatic part of the umbilical vein has disappeared. But it is the infrahepatic part will form the ligamentum teres hepatis. It persists till birth. After birth, it becomes degenerated. But here, from the very beginning, the right umbilical vein disappears. তাহলে কি থাকলো পড়ে? Right vital line and right common cardinal. The right vital line vein, this right vital line vein, the suprahepatic part will form the terminal part of the inferior vena cava. It will form, right vital line vein will form the inferior vena cava. And this common cardinal vein, right common cardinal vein will form the part of the superior vena cava. Part of the superior vena cava. Right? Now come to the right horn of the sinus venosus and right part of the body. This is the right horn of the sinus venosus and right part of the body. What will happen? That will be absorbed. That will be absorbed in the wall of the right atrium. In the wall of the right atrium. And it will form a smooth part of the right atrium. Posterior smooth part of the right atrium. When I will discuss about the septation of the atrium, you will find the main atrial cavity will be separated by, I have already discussed, from three sources it becomes separated. Number one, septum primum, septum secundum and septum intermedium. Right? So it will be divided into right and left. The right portion has got rough part, tabiculated rough part and a smooth part. Now the posterior smooth part of the right atrium actually develops from absorbed part of the right horn of the sinus venosus and the right part of the body of the sinus venosus. Right? Now this septation actually heart tube develops. I have already told you during the third week, the nutritional demand of the embryo is much increased, and to satisfy this nutritional demand, separate vascular system has to develop. Before that, up to the second week, it was nourished by the process of diffusion. But due to the increased demand, during the third week, separate vascular system was developed. Right? Septation actually starts from the 4th to 8 weeks. Within 8 weeks, all septation will be completed. So during 4th to 5th week, this septation starts, and septation it does not one by one. Though I am discussing one by one day I discuss about the partition of the left atrium, next day left ventricle, but it is not like that. All septation starts simultaneously. Because of our convenience, we are discussing one by one, but the thing is not that. Septation, all septation is occurring simultaneously. Do you get it? So now let us discuss about the again I am discussing the development of the right partition of the atrial cavity. This is the atrial cavity, a primitive atrium. You know, the atrium is connected with the primitive ventricular cavity through AV canal, atrioventricular canal, AV canal. Now on the dorsal wall of this AV canal and ventral wall of the AV canal, endocardial cushion develop. এখানে তো dorsal আর ventral দেখানো যাবে না. You have to imagine. Now they proceed to each other and ultimately join. And they will separate the AV canal into right and left half. Now, this AV cushion, they will form, when they will mark, they will form, this is called septum intermedium. This is called septum intermedium. Septum intermedium. This septum intermedium and another septum will develop, I will discuss later on, that is cono arterial septum, truncus arteriosus, conus, the cono arterial septum. This septum actually has got some contribution from, it is very important, you note it. It has got contribution from neural crest cells. It has got contribution from neural crest cells. So within it there is some component of neural crest cells. And neural crest cells take part in the development of the head neck, structures of the head neck. If there is any congenital malformation of the head neck, you will invariably find that defect is also reflected, but this defect is also found in the heart. Because it is thought that it might be due to the neural crest cells. So this septum intermedium has got contribution from neural crest cells. Now I am talking about the septation of the atrial cavity. From the roof of the primitive atrium, one septum develops. Its lower margin is concave. অতদিন না মনে থাকে বলবি না, এরকম এটাই রেখে দে। অনেক বই লেখা আছে, অনেক বই লেখা নেই। So here you see, it has not reached up to the septum intermedium, so space is like here. That is called foramen or ostium primum. That is called ostium primum. Ostium primum. Ostium primum. Because of the progressive growth of the septum primum, this ostium primum will be obliterated. And it will come in contact with the septum intermedium, and it will fuse with the septum intermedium, and this foramen is obliterated. Now to allow the passage of blood from right to left, another foramen is necessary to develop. That will develop at the upper part of the septum primum. Some cells die here. Some cell undergoes natural death, apoptosis, and here one foramen is formed. That is called ostium secundum. This is called ostium. Septum secundum has formed. Foramen or ostium secundum. Now another septum will develop on the right side of the septum primum from here. Here you see this sinoatrial orifice has become a vertical slit, and it is now known as this opening. It is a right venous valve and a left venous valve. Left venous valve, and cranially they have merged, and it will form septum spurium. Septum spurium. And caudally it is also known as sinus septum. Sinus septum. These are all derived from the opening guarded by sinoatrial orifice, and their boundary is known as septum spurium, right venous valve, left venous valve, and septum sinus. This part is known as interseptovalvular space. This space from the origin of the septum primum and the septum spurium, this part between the two septums, so interseptovalvular space. That day I made some mistake. Septomarginal space বলেছিলাম আগের দিন. But not septomarginal space. You should correct it. It has interseptovalvular space. So within that area, another septum will develop. That is called septum secundum. Second septum. So septum secundum. Right. This septum secundum will develop so much that it can cover this foramen. It can cover this foramen. So it has to grow deeper, and it has to overlap the septum primum. Primum কি এখানে ওভারল্যাপ করেছে? যদি ওভারল্যাপ না করে এই পর্যন্ত হতো, it will not be able to effectively close the septum secundum, foramen secundum, right? So it has grown so much that it has completely covered this foramen, as well as it has overlapped the septum primum. Now, before its development, the connection was direct between the right and left half. Now, because of this development, now this opening has become oblique. This opening has become oblique. This oblique passage is known as foramen ovale. Very important thing. This oblique passage is known as foramen ovale. Foramen ovale. Now heart is not functioning, lung is not functioning in intrauterine life. Blood is coming here, right atrium, and that blood is, as pressure is higher here, so blood is coming through this. But when blood will come on that side also, then there will be equalization of pressure. When blood will come, when the lung will start functioning, you know from the lung, blood is coming to the left atrium through pulmonary vein. When lung will start functioning, so through left atrium, from pulmonary vein, left pulmonary vein, blood will come on the left side of the atrium, and now pressure will be equalized, and that will press the septum primum against the septum secundum, and this will be closed. In this way, it will be closed. Sometimes in 20 to 25% cases, it is not completely closed, but there is some patency. If you introduce a probe, the probe will go inside. That is called probe patency. But functionally, it will not hamper the function of the heart, because of the pressure, it will close this side. So there will be no mixing of blood from right to left. Right. Now, if you are asked to write as a short note the development of interarterial septum, now, or if you asked in practical exam, what are the sources of development of interarterial septum? Key source? Number 1, septum primum. Number 2, septum secundum. Number 3, septum intermedium. Right? Sometimes another source, little source, that is this septum spurium and left valve of the sinoatrial orifice, they merge with the septum intermedium, septum secundum. They merge with the septum secundum. So they are also contributing to some extent. এটা খুব মেজর না, যদি বলতে পারি ভালো। তাহলে পড়ে থাকলো এখানে right horn of the sinoatrial orifice. This right horn. A right horn sinoatrial orifice. Right. Now let us discuss about the development of the right atrium. Now let us discuss about the right atrium. Now development of the right atrium. What are the sources of the development of the right atrium? Number 1, you know there is a cavity that is primitive right atrium. Primitive right atrium. This is the primitive right atrium. Here is the septum intermedium. Now, different color I am using. This is septum primum. This is septum secundum. Here lies the right venous valve. I have already told you the sinoatrial orifice is guarded by This valve, it was first it was big, now it has become slit. Its left wall has become merged with the septum intermedium. Right half is left. That will be divided into some muscular ridge. Superior, here lies the opening of the inferior vena cava. Here lies the opening of the inferior vena cava. Here lies the opening of the superior vena cava. Here lies the opening of the coronary sinus. If you see the adult heart, you will find so many openings on the right atrium. Superior vena cava, inferior vena cava, and coronary sinus. Right? Now this right venous valve it is divided by three parts. This venous valve is divided by three parts by two bands. The name of this band is superior limbic band, and this is the inferior limbic band. Three parts. Now I have already told you that the interior of the atrium, there is a smooth part and there is rough part. The posterior part is a smooth part that was developed from the right sinus venosus, wall of the sinus venosus, and right horn of the sinus venosus, that has contributed to the smooth part. Our original atrium will give rise to caviculated part. Between this smooth part and rough part, there is a ridge. It will be asked in your exam. It is very important from your examination point of view, the interior of the right atrium. If you see the interior of the right atrium, there is a rough part and a smooth part, and between these two parts there is a partition. That is called crista terminalis. That is called crista terminalis. That crista terminalis is developed from this right venous valve, upper part of the right venous valve. This part of the right venous valve, it will form the crista terminalis. And between the superior and inferior band, this is the opening of the inferior vena cava. That vena cava is guarded by valve. That part will form the valve of the inferior vena cava. And part beyond the inferior limbic band, that part will form the valve of the coronary sinus. Valve of the coronary sinus. Right? So, now all these should be mentioned in your development of the right atrium. Another part I have not yet discussed, another smooth part. There is a posterior smooth part and there is also an anterior smooth part that develops from the atrioventricular canal. This develop this canal into two parts, right and left. So from there, right atrioventricular canal also contributes to the smooth part of the right atrium. তাহলে কতগুলো সোর্স হলো? অনেকগুলো সোর্স হলো, বুঝলি তো? প্রথমে প্রিমিটিভ রাইট অ্যাট্রিয়াম, তারপরে স্মুথ পার্ট, তারপরে ক্রিস্টা টার্মিনালিস, তারপরে সাইনাস ভেনোসাস. All sources should be discussed.